Hi friends, I am Dr. Harmeet Goel, your Obs Gynae faculty and a consultant of Obs Gynae in a reputed cancer institute of Delhi. I want to talk about the importance of Obs Gynae subject as an important subject while you're writing your entrance exam for the PG exams or for UPSC exam, as an important subject for making your career in Obs Gynae. Now, let me start up with why the Obs Gynae subject is important while you're writing your exam as an undergraduate exam or you're writing for your PG entrance exam. Now, Obs Gynae subject is comparatively an easy subject and easy to score marks. You can attempt all the questions which have been asked in either INICET exam or in the NEetpg exam or in the fmge exam or in the UPSC exam. Obs Gynae subject plays a very, very important role because one important point you must understand that there is not a super specialization. Like while you are attempting the questions of medicine or surgery, there is super specialization available. With due respect to my fellow faculties of medicine and surgery, in Obs Gynae, there is a fellowship or there is a DNB course available in gynae oncology or gynae oncosurgery, or while you want to become an infertility specialist or you want to do IVF or ICSI techniques, to treat the infertility couples, then you can do the fellowships or the courses in the Obs Gynae subject. But as far as your questions in your exam is concerned, I have not seen in the present, the type of questions which is being asked in various exams that too much integrated is being asked till today. Maybe in future we can't say, but till today, not much very difficult questions are being asked. It's not that I am teaching this subject or I am practicing this subject, not because of that. But most of the students, they do not get stuck up in Obs Gynae questions. So you can score almost full marks in Obs Gynae subject provided that your basics are very, very clear. In comparison to the other subject, it is highly a scoring subject. Like when you talk about the NEetpg or you talk about INICET exam, many questions can be repeated, but the format of questions can be changed. But if your concept is very, very clear, you are able to apply the concept in the course. Now, when an image-based questions are being asked, for example, polycystic ovarian disease or, ovarian hyperstimulation syndrome or endometriosis or cancer cervix or, from the pelvis or the fetal skull, you are able to score almost all the questions very, very correctly. So make this subject as your strong subject while you're attempting any exam. Now, Obs Gynae as an important subject for your career. Why I'm saying it is a very, very important subject for your career? Because early settlement, easy settlement, plus good amount of money you can earn, plus if you have done a 1 year of house job in Obs Gynae or a 6 months of house job in Obs Gynae, that is, very, very earliest at the smallest level you can do your practice. You can see the antenatal cases, you can see the gynae cases, you can do the MTPs, you can give the contraceptive advice, etc. So you can start your own practice. You don't require a very, very big setup. Now, if you have done a diploma in Obs Gynae or you have done MD or MS in Obs Gynae or you have done DNB in Obs Gynae, again it gives you an immense satisfaction and you can start your good practice. If it is an hospital-based practice or you are doing at your own clinic, people will always keep on coming to you because in our country like India, marriages are going to happen, so the obstetrics will continue. Okay, now this is the only subject when we talk about the obstetrics where you have a fruitful outcome. When you're conducting the deliveries or you're doing a cesarean section, you are giving a gift to the parents, that is the baby. So that will give you an immense satisfaction and the people around you will be happy. So the net result of obstetrics is a happiness, you're spreading happiness. Now, when we talk about the gynecology practice, many of the infertility cases are rising nowadays because of the plenty of factors, late marriages, career settlement, and whatever they are planning the family quite late. So many reasons are there. some environmental factors, some dietary factors are there, some like treatable or some are non-treatable factors. So infertility cases are keep on rising everywhere. So when you are giving the treatment of infertility and the couple conceives, so that will give you again a very, very pleasure or a satisfaction that you have, treated the infertility couples, and so many examples are there. So as a subject, it is very, very important. As a career option, again, it is very, very important. So you can choose Obs and Gynae subject as a subject of your choice for your career, for your early settlement, and of course, good amount of money plus immense satisfaction in obstetrics and gynecology. So with this, thank you very much and bye-bye.